Hello, friends. I'm Dr. Mukhmohit and I welcome you to this new module on a very important topic and very frequently asked to me topic that we are going to talk on MCI FMG screening exam. So, I thank you all for your loving messages and all the inspirations that you send me, and that has motivated me, in fact, to talk more and more on my loving subject, that is community medicine or public health. So today we'll be taking this session on foreign medical graduates MCI screening exam. I have divided this session into three equal parts. First, we will talk about the foreign medical graduate exam. Then we shall talk about an important aspect, that how to prepare for this exam. What are the things or subject-wise approach for this exam? And last is some do's and don'ts I would like to share with you. So let me first talk of this introduction about foreign medical graduate exam. See, FMG exam is conducted 2 times a year. It is conducted one in December and in June every year. And this from last year it was online pattern. So in June and December exam, in totality, I think most of you have already started the preparation. So other students who are pretty young in their MBBS curriculum, you might find this useful, that there are 300 MCQs, and these 300 MCQs are to be given in two parts. You have a part A and part B of the exam. The part A consists of all the pre and the paraclinical subjects, whereas part B consists of the core clinical subjects. So the pre and the para subjects would be something like anatomy, physiology, and biochemistry from the first year of MBBS. And in pre-para, that is part A, you also have patho, pharma, and micro from the second year of MBBS, and you also have forensic medicine from the third year of MBBS. So these are your subjects which are covered in pre-para, that is part A. The clinical subjects are all the clinical remaining subjects: medicine, surgery, gynae, peds, then you have community medicine, skin, anesthesia, radio, psychiatry, ortho, all these, and eye, ENT, all these are the clinical subjects. So try to understand that this is how the FMG exam would look like, that it is conducted twice a year, 300 MCQs, and these 300 MCQs you need to give in part A and part B, and the total time duration that you get is 2.5 hours for part A, plus another shot of 2.5 hours for part B. So in totality, you will be given 5 hours for solving this 300 MCQ single answer exam. So that is, you need to know the very basic. So I think most of you, 90% of you who are watching this video would already be knowing this, because this is the most basic thing you need to study, you need to know for your exam, right? Now comes a very important part, that according to my personal analysis, what all, the other day I was in Gautam Nagar and in Delhi, and I was talking to a couple of students, and I got this idea that there are actually two categories of students. I saw this December 2018 exam, and do you know that in December 2018 exam, roughly approximately around, from my data, is 13,000 students appeared for this exam. Out of those 13,000, approximately, not going with the exact numbers, approximately 1,479 or 1,500 students cleared this exam. So that gives me a pass percentage of roughly around 10 to 11%. So now there is something more deeper into it. The students, all those 13, 15,000 who have actually come from Russia, from China, Philippines, and they have given this FMG exam, what do you think? They all did not want to pass? Everybody wants to give the exam and wants to settle down in India and wants to get that status of doctor in India. But I found two different types of students. I found a student who actually had the felt need, don't take it personally, who had the felt need. So this is just my personal observation. There was a student who had only one thing in hand, and that thing was this: to clear this FMG exam, that is the MCI exam. The other student had a lower felt need. They also had that need. Everybody wants to pass the exam. But when I talk to students, that zeal in them, that enthusiasm, that requirement, that urgency to clear the exam was somewhat lower. I would not say lacking, but it was lower. So now, how actually would I know that who was okay or not, or maybe something who had the felt need? So the person who had only MCI exam in focus, actually what happened was he or she went outside. They talked to their seniors, super seniors, mentors, teachers, parents, brother, sister, anybody in the world, because they had only one thing, that is to clear the MC exam. Their target was only one. So therefore they went here and there and they asked everybody how to clear this exam. That is the only thing. Trust me, try understand. My observation is that a student who actually knew how to clear the exam in reality cleared the exam, and a student who did not know how to clear the exam in spite of his felt need of clearing the exam did not clear it. Mark these words, listen it again, that the students who actually knew how to clear it, they did clear it, because there was no other thing they wanted to do and there was no other target they wanted to achieve. They had only one target, that is to clear the MCA exam, and they did it very nicely. So you need to know that how to clear the exam is very important. For that, you need your teachers, you need your support, you need your faculties, you need your seniors, you need your elder brother, sister, anybody. You need people who are able to guide you. So that how is very important. So let me discuss phase two of this topic that I am here to discuss today. So I'll show you something about the subject wise marks. So as you can see on your screen right now, you can see, can you see that on this axis you have all the subjects, and on this axis, on the vertical axis, you have the marks, subject wise marks. So you can see that these all these subjects, anatomy, physio, biochem, patho, pharma, microforensic, all these subjects are included in the part A of your MCI exam. And all the other subjects, you can see from this side, all the other subjects, these are included in your part B of your MCI exam. You need to score 150 in totality. So now if you understand this, just look at the medicine, surgery, gynae, peds. Can you look at the numbers 30, 30, 30, 30? So that gives you total of approximately 125 MCQs. So trust me, out of 300 MCQs, 125 MCQs are only from 4 subjects: medicine, surgery, gynae and peds. Medicine, surgery, gynae and community medicine. So why would someone leave these subjects and go for the exam? I know many people, many seniors would not agree to me on this point, but I am full in confidence. I'm telling you, if a student leaves medicine and goes for the exam, it is highly unlikely that you will pass the exam. Why? Because simple fact that medicine, surgery, gynae, community medicine, it is all big subjects and they comprise 50% of your total MCQ that you need to clear. So out of 300, you need to have 150 to clear this exam, and out of 150, 125 is directly given by 4 subjects. So why on earth would somebody leave the subject and go for the exam? So please remember, these are your category A subjects. These are your highest priority subjects. Don't leave medicine, surgery, gynae, PSM for your exam. Category B subjects is anatomy, physio, biochemistry, patho, pharma, micro, and ENT and pediatrics. So according to me, these are category B subjects. You can see they have their range of 13 to 15 MCQs. They are also important. Don't leave these subjects. They will help you in your exam. Okay. And then you have the other subjects like skin, anesthesia, radio, forensic. So these are smaller subjects. They will help you in the exam. But of course, don't forget about medicine, surgery, gynae and community medicine. This is 50% of your exam. So trust my words. Medicine will give you hints about skin also, about anesthesia. Surgery will give you things about anesthesia. Pharma will give you things about anesthesia. Skin, you have like a lot of overlap is there. I'm not against these subjects, but don't leave medicine surgery, because that is the driving force for you, okay, for you to just pass this threshold. So trust these things, subjects, that these are very very important subjects, and they will be obviously helpful for your exams. So if you know this, now you make your own schedule and you make your own plan. So with that, I come to the next part of this session. What I wanted to discuss is some do's and don'ts. So what I would suggest you is, these are my personal opinions, and in no way these are like a universal law. They are not a universal law, but these are my personal suggestions to you as senior, as a friend. My suggestion first to you is, always, in fact, this is one point which actually differentiated the students who cleared this MCA exam from the students who could not clear this MCA exam. The first thing was, everybody who cleared it had a timetable. You make a strategy, you make a plan, you write it down on a paper, stick it on the wall, look at that every day. Till the time you don't have a target, you'll go confused running. There's no need of doing a confused running. So make a timetable, stick to that plan. If you don't do this step one, I think your starting phase is you're lost. Okay, make a timetable, stick to that plan. Second, very important is, I have seen students who cleared this MCA exam. When I talked to them, when I saw their copies, students who attended my class, or in fact, I would say I had the privilege of teaching them. So, students who attended my class, when I saw their registers or copies, I found out beautifully written notes. A student who attended surgery class by some faculty, and they had written beautiful gallbladder diseases. Then you categorize gallbladder stone, then you cholelithiasis, cholecystitis, treatment, pathology, everything about gallbladder stones. You write about acute myocardial infarction, types of STEMIs, non-STEMIs, everything in a very beautiful manner. User friendly notes. The students who cleared this exam, they did not take notes from anywhere. They did not buy notes from the booksellers. They did not copy or xerox the notes from other students. They made their own handwritten notes. With the hand, they wrote the notes. They highlighted the important points, and somebody told in YouTube class that you need to do this CPK enzyme should be 20 to 50, 20 to 20. So they wrote it there in the copies only. So they made one single note, and they added more information to it, a beautifully prepared user friendly notes. And mind you, the way I eat is not the same you would eat. The same way, the way I make the notes are for me, the way you make your notes will be for you. I cannot make notes for you, or you cannot make notes for me. You'll never understand my psychology. I'll not be able to understand your psychology. Notes are personal. If I want to take your notes, probably that should help me in making my own notes, not to take your notes and study it. It's not going to solve the purpose. Students who have cleared it, they had these two direct phenomena, and I'm sharing you with you that if you also adopt these phenomena, you will clear it. I guarantee that. Third point, some do's for you. Third point, this is what a student told me. The example I told you, I met a student in Gautam Nagar, and he gave me this insight that, sir, I actually found my own way to revise. He told that I sat in a group. It did not work. We all were talking about films. We started talking about actors, actresses, and things like that. We started talking about teachers. So we wasted our time. So then he told that I started studying in the night. It was very sleepy, dull. I did not want to do that. So what he did was, he took a question bank, online question bank from an institute, and he tried to solve 50 questions every day evening, or 100 questions every evening he would solve. And he would solve it, not see the answers. I'm not saying see the MCQ and the answer. He would just see the MCQ and solve it. The questions he did not know, he found in the book, and then solved it, and then saw the answers. He solved that. That gave him the revision module. Are you getting it? So what I want to say, third point is, find a way. Very important. Find your own Find your own way to revise. Don't copy somebody else. Find your own way. I'm sharing with you the things I know. Some students sit down in groups and they revise very nicely. Some students don't. You find your own way. Group discussion. Or some students, what they do is they sit down in morning, or they sit down in night, or they sit down during day, or they sit down during evening. Whenever you sit down, at least sit down and revise. What is comfortable to you? You find your own way of doing the revision. Some students would sit down for very long hours for revision. Or some students have very short hours for revision. So make your own way to revise. Find your own way to study. Don't copy anybody. My clothes will not fit you. Your clothes do not fit me. Everybody has their own mechanism. So trust your mechanisms. Fourth number, make a single notes that we have already discussed. And the students who cleared it, they also had a habit of making the notes from, very important, frequently asked exams. So go back to your FMG books, find out the last 5 year, 7 year questions, you study them, you'll find a reasonable topic trend. Every year exam, they are asking questions from mucopolysaccharidosis in biochemistry. You have questions from glycogen storage disorders. You can't deny it. So that becomes a very important topic for you. Every year you get questions from hernia in surgery. So that becomes a very important topic for you. So in that case, you need to understand how to prepare. So make out notes from previous year MCQs or frequently asked questions. And last is, I always say to my dear students, whenever you feel stressed out, talk to someone. Talk to someone. You share your things with someone, your parents, your mother, father, brother, sister, friend, teacher, mentor, senior, super senior, anybody. You talk to someone, share your thoughts. In fact, I would say all through your journey, you should always have somebody who's on top of your head, because alone you tend to get lost. You don't know the correct way. You keep somebody on your head, maybe your senior, somebody, parent, brother, sister, your friend, anybody. You keep them on your head, share your timetable with them, discuss your weekly performances, say that I'm here, I'm not here, I want to achieve this, I did not achieve this, I failed to achieve this, I will achieve this. This will help you engage yourself, this will help you introspect yourself, and actually you will see a drastic improvement in your performance. Don't feel shy of these things. Talk to your seniors, talk to your teachers. You take up any faculty, you share your thoughts with them, and they'll be much more than happy to guide you. Okay. There are some don'ts I would like to tell you. Some don'ts which I am also scared of. Many students have that habit of doing it. There are some don'ts I would say. The first don't I would like to share with you is, don't get into that habit of studying. Don't study new things. What do I mean by studying new things? See, you might do ophthalmology in 3 years by doing PG. Then you do 2 years fellowship in glaucoma, and then you do 1 year fellowship in some specialized operative technique for glaucoma. So there is no end to study of ophthalmology, a small organ like eye. So there is, you can't say this is medicine, you can't say that this is surgery. It is an ocean. There is no end to it. You should be face to face with the fact that you are MBBS right now. You are to study at the MBBS level only. So don't try to dig into things. Do not dig into things. Do not dig deep. Stay shallow, stay calm, and try to do the maximum number. Don't try to go into the super specialization level. It is not required. It is futile exercise. I know you will gain knowledge, but that knowledge does not carry any meaning at this moment. Live in the present. Don't think of future. Live in the present. At present, MBBS, MCI exam, MCI foreign medical graduate screening exam, you have to hit it hard. So stay where you are right now. Second, so don't try to dig too many things. Second, I would also like to share with you that some students do not take breaks and they have long hours of study. I personally say that 2 to 3, roughly around 2 to 3 hours of study is reasonably okay, although it's on a higher state level, but it is reasonably okay to sit down for 2 to 3 hours, take a break, again sit down for 2 to 3 hours. So do not get long hours. Take frequent breaks for maybe bathing, food, or maybe recreation, or just stand up and rotate your shoulders, rotate your neck, do some cervical exercises, just move your back, and that'll keep you fresh, that'll keep you rejuvenated. Sitting for long hours will only make you more dull, and it will decrease your efficiency. Your computer also needs to shut down after some time, right? So do that. Take small breaks in between, and 2 to 3 hours should be a good reasonable time for you to have this. And with this, I would also like to inform you that I have seen students, they will always, that's what I used to do. I used to sit for 2 hours, and I used to fix a target for 2 hours. I used to fix a target. In fact, now also I do that. From 10 a.m till 12 afternoon, I'm going to do this, and I need to finish this in 2 hours. So I make small targets. So these are like micro targets, that I will study hernia in next 30 minutes. I'll solve all the MCQs from this chapter in next 30 minutes. I'll start from 587 till 1027 in next 5 hours. So you make small targets. So fix a target. You should know what you are going to do, and you should know the time in which you're going to complete. And that's what I used to do for 2 to 3 hours. So don't sit for very long hours. Please remember, another thing is, many times we get that habit of having excessive tea or coffee or cigarettes or something. So no bad things, because these things are going to spoil your body. At the end of the day, it is you who is responsible for your body. Do not take the maybe excuse that because you're studying you need more tea. Take warm water, simple plain warm water. Maybe you can add some sugar and salt into it, that will give you that taste. But don't waste your body on maybe tea, coffee, or cigarettes, or any addiction. It's not going to be of any help to you. And last is a big time don't is, restrict your time on social media. Restrict your time on social media. I have seen students who have cleared the exam, and they were very clear in this, that till the time I was studying, my phone was switched off. When I got up for taking a small break, 30 minutes break, I just switched on my mobile and saw it, and 30 minutes I am off with it. You need to be very time punctual person. Restrict your time, because social media is something like, the a question will pop up that, what is maybe nephrotic syndrome. So you're studying nephrotic. From nephrotic, you'll go into Alport disease. Alport, you'll go into genetics. Genetics, you'll go into chromosome. There's no end to it. You'll unnecessarily waste your time, not required. So restrict your time on social media. Don't do that monkey hopping type of thing. I am doing this, then I do this, then I do this, then I do this. Not required. Do what you are supposed to do in your 2 hours or 30 minutes break time, or 2 hours of study time. Restrict your time on social media. I'm not saying don't use social media, because many times, as faculty, I need to tell you the recent updates in tuberculosis program. Somebody needs to share some new pharmacology drug that is there, mechanism of action, that will help you revise. But a smart person would be who uses these things smartly. So once you know how to study, this is what I wanted to say, that students who actually cleared the exam, they knew how to study. And how would you know that how to study? Is by the amount of urgency that you have in you, that I want to finish this exam right now only. So if you want to finish it right now, you need to take a mentor. You need to take some senior who's going to guide you all the way. You need to decide your subjects where you need to lay stress upon, and you should know what the exam is and how the exams are being taken up, right? So with that, I would thank you for all your time, and for any doubt that you have, you're most welcome to ask us on this. Is my WhatsApp number 8699014009. So any doubt, we have our WhatsApp and Telegram groups. So you will be joining in these groups, and you will be attending these live discussions that we share on the groups and Telegram groups and WhatsApp groups. And any doubt you have, you're most welcome to ask us. Or you can directly log on to Facebook on my group, that is Mukhmohit's Community and Medicine Discussions. So this is the group on Facebook. So you're always welcome to post the doubts or controversies that you have in your mind. Any questions, anything you would like to share, most welcome to put it on Facebook or on the Telegram group, and I'll be happy to answer you. I pray to God that you keep on shining, study very, very hard, and just put your heart and soul into these 3 4 months, and it is going to fetch you fortune. I guarantee you this. So you should know how to study. Don't do confused running. Do a very strategic running. You should play with your mind, not with your heart. So you should know what you're doing, and once you know what you're doing, you should do it, implement it. That's it, right? So stay focused, do your hard work, and all the very best for your exams. Thank you so much.